Botox, onabotulinum toxin A, is a medicine for adults with chronic migraine, which is migraine with 15 or more headache days a month, with each headache lasting 4 hours or more. Botox is not approved for adults with migraine who have 14 or fewer headache days a month.
My name is Kelly, and I'm from Springfield, Missouri. I'm very close with my family. We like to spend a lot of time together. I'm especially close to my sister. She's very supportive, and she's somebody I can always count on. I remember my first migraine. I was in my early 20s. I wasn't sure exactly what was going on. I had a terrible sharp pain right over my left eye, very sensitive to light. I didn't know why. I only wanted to be in a dark room. That was my first migraine. After that, my migraines and headaches started to happen more frequently and more often, and they really came back with a vengeance. I even had to stay home from work sometimes because the symptoms were more than I could take. It was at that point that my doctor put me in contact with a specialist at the local headache center. This was the first time I've had somebody explain to me exactly what had been going on, not just at this time, but over the last 10 years. I would have a migraine and then a period of time where I wouldn't have headaches or migraines, and then I would kind of keep repeating that. And that is what they call an episodic migraine. Now that they were basically so close together that I was having them nearly a daily basis, or 15 or more a month, now I actually have chronic migraine. After my diagnosis with chronic migraine, my headache specialist recommended a different type of medication to try, which was Botox. He told me it was the only medicine specifically approved to reduce the number of headache days. Once my headache specialist recommended Botox, I wanted to go ahead and do some research and check it out to make sure it was okay for me. So I took home the brochure that my doctor gave me and looked up more information about it. After I did my research, I met back up with my doctor. We went over the risks and the benefits again, and we decided that it was the right option for me. I was a little bit concerned about how I was going to pay for it. I wasn't sure if insurance was going to cover it and how much. Happily, my insurance covers a good portion of the cost of treatments. The doctor did tell me about a program that Botox offers called the Partnership for Access program, which helps cover some of the out-of-pocket expenses. Between insurance and that program, it was affordable for me. Look, I lost out on a lot of activities in the past because of my chronic migraine. One that I'll never forget is that my sister ran in a marathon race, and while my entire family was there cheering her on, I was home in bed, curled up with the lights out, not able to go. It was really hard for me to know that I had missed something that was so important to her. These days, I'm making fewer marks in my headache diary, and there's some days where I don't even make a mark at all. And that's so exciting to me because I didn't think that there was going to be a time where I was ever going to have that.
Botox is a prescription medicine that is injected to prevent headaches in adults with chronic migraine who have 15 or more days each month, with headache lasting 4 or more hours each day in people 18 years or older. It is not known whether Botox is safe or effective to prevent headaches in patients with migraine who have 14 or fewer headache days each month, episodic migraine. Important safety information. Botox may cause serious side effects that can be life-threatening. Get medical help right away if you have any of these problems anytime, hours to weeks, after injection of Botox. Problems swallowing, speaking, or breathing due to weakening of associated muscles can be severe and result in loss of life. You are at the highest risk if these problems are pre-existing before injection. Swallowing problems may last for several months. Spread of toxin effects. The effect of botulinum toxin may affect areas away from the injection site and cause serious symptoms including loss of strength and all-over muscle weakness, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, loss of bladder control, trouble breathing, trouble swallowing. There has not been a confirmed serious case of spread of toxin effect away from the injection site when Botox has been used at the recommended dose to treat chronic migraine. Botox may cause loss of strength or general muscle weakness, vision problems, or dizziness within hours to weeks of taking Botox. If this happens, do not drive a car, operate machinery, or do other dangerous activities. Do not take Botox if you are allergic to any of the ingredients in Botox. See medication guide for ingredients. Had an allergic reaction to any other botulinum toxin product, such as Myobloc, Rimabotulinum toxin B, Dysport, abobotulinum toxin A, or Xeomin, incobotulinum toxin A, have a skin infection at the planned injection site. The dose of Botox is not the same as or comparable to another botulinum toxin product. Serious and/or immediate allergic reactions have been reported. They include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Get medical help right away if you experience symptoms. Further injection of Botox should be discontinued. Tell your doctor about all your muscle or nerve conditions, such as ALS or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, as you may be at increased risk of serious side effects, including difficulty swallowing and difficulty breathing from typical doses of Botox. Tell your doctor about all your medical conditions, including if you have or have had bleeding problems, have plans to have surgery, had surgery on your face, weakness of forehead muscles, trouble raising your eyebrows, drooping eyelids, any other abnormal facial change, are pregnant or plan to become pregnant. It is not known if Botox can harm your unborn baby. Are breastfeeding or plan to. It is not known if Botox passes into breast milk. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Using Botox with certain other medicines may cause serious side effects. Do not start any new medicines until you have told your doctor that you have received Botox in the past. Tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myobloc, Dysport, or Xeomin in the past. Tell your doctor exactly which product you received, have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, take a sleep medicine, take aspirin-like products or blood thinners. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. For more information, refer to the medication guide or talk with your doctor. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Botox full product information, including boxed warning and medication guide.
My advice for people with chronic migraine, ask your doctor about Botox treatments.
My name is Ilaria Baldwin. I am over 9 months pregnant with my 4th child in 4.5 years. And I'm really excited to meet him, and I'm really excited to not be pregnant anymore. This baby is a little bit different than the others because he's extra big. I tend to have bigger babies because I was the genius who had babies with Alec Baldwin, who's really big, and I'm not really big. I have a 1-year-old, a 2-year-old, and a 4-year-old at home, and they require so much so that when you want to lay down and you're so tired, you can't do that. It's not allowed. I've bounced back pretty easily after each pregnancy. I think number 1, I was fit before. I stay fit during, so even though my body gets bigger and I gain weight and I slow down, I try to do something active almost every single day. And then I've been very blessed to have pretty easy labors and deliveries, so therefore I can return to my normal activities. I think that staying active, even when I don't want to, even when I'm so tired, I want to just sit on my butt when I have a moment, I know that I'm going to feel better and I'm going to be healthier in the long run. The one thing is, because this baby is bigger and because of that there is some extra fluid around him, he's having trouble dropping. So then you sort of wonder, wow, have I had 3 vaginal births, and then all of a sudden I might need to have a C-section on my 4th pregnancy. So far it's not looking like that, but you start to think about that's that 3 a.m. you wake up and you start panicking about something. But I'm trying to keep as calm as possible. I post my pregnancy photos online on my Instagram, and that I think has helped just to sort of say, hey, you know what, your body is going to get bigger, and then having the confidence to know that my body is going to go back and that it is possible. I work out almost every day. I will let myself have a day, especially now when we're in like the dropping phase, where I'll have a day where my workout might be that I walk a lot. I'm a big believer in Kegel muscles. I think it helps tremendously with pushing, and I've been very lucky to, push these big babies out like ching. The beauty of exercising, whether it is yoga or bar, any kind of thing, you're naturally doing Kegel exercises. So I think understanding the Kegel and being able to do that in the reverse really focuses you on pushing it. I'm very active with my kids, so even if I don't make it to the gym, I'm bathing them and lifting them in and out of the tubs and in and out of the high chairs. Yesterday I was moving furniture around the house and stuff like that, and so it drives my husband crazy. He doesn't like change whatsoever. I wait until my husband leaves, and then I'm like, all right, here we go. I think one of the most important things is don't be afraid of your body when you're pregnant. And I know that the first time around, we have to go through that fear. One of my favorite things is when Alec brings me like my first meal after giving birth, and you get to eat again and you're hungry for the first time. It's so magical. So I'm looking forward to that. I rest for as long as I feel I need to rest. I've had a whole life of learning to listen to my body. I had an eating disorder growing up. I was a dancer, I was a gymnast, I was, go, 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 go. I broke my hip when I was 25 from over-exercise. So like it's the quintessential not listening to your body. And so I am hyper aware of what I'm feeling at almost all times. When I met Alec, I grew up with no TV. I was a yoga teacher. I lived in the yoga studio all the time, and I really had no contact to the outside world whatsoever. And all of a sudden, there's photographers following you around, all this different kind of stuff, and I became very closed down because of that experience. And it felt very not me who I want to talk to everybody and I want to be friends with everybody and everything should be okay. And so what I started doing was just saying, hey, you know what, I'm gonna open the doors into my life, and this is what it is, and it's not so like, wow, I'm really not that interesting. I'm a very, I wake up, I eat a bowl of cereal, I go about my life. It's very, very, very normal. I just wanted to get to a point where saying, okay, look, this is how I do it. I'm not getting liposuction. I'm not going and doing XYZ. And there's also going to be people who just don't believe me and whatever. You can't win everybody over. But kind of like, I'm opening my doors. This is who I am. You can do it too. I'm doing it in a very natural, very healthy, very thoughtful way. My birth went really well, and he is super healthy and happy. One thing is I got pneumonia a few days before I delivered him, so I had pneumonia while delivering him, which was not so fun. Rafa and Leo got the flu, and Carmen came home with pink eye. I fractured my ribs from so much coughing. That plus being extremely sleep deprived, I got mastitis this time around, which was horrible. I've never had the 4 babies, never had that. So it has been slower this time around. Now that we're healthy, I'm ready to hit the ground running. I think most of my days are pretty good. My best days are when everybody is feeling like they're being taken care of, nobody's crabby. My body is used to moving. So I am able to start moving pretty soon after the pregnancy. I don't necessarily like to call it working out because people think of working out as like, spending an hour in the gym and sweating and this whole thing. I mean, I think about it as allowing my body to move again. You're gonna be a better mom if you work out. I know that it feels hard. I know that you maybe be tired. But if you can get at least 5, 10 minutes, 15 minutes, maybe 30 minutes a day where you can move your body, you will have more energy for your kids. You're going to feel more connected to yourself, and it's really going to make you stronger for everyone around you. If you don't take care of yourself, you're not going to be able to take care of everyone else.
Hi, I'm Normani Corday, and my mom is a breast cancer survivor. You can increase your chances of finding breast cancer early when it's easier to treat by getting your regular mammograms. So please talk to your doctor today and see if you're due for your mammogram. Early detection through regular mammograms can save lives like my mom. Learn more from the American Cancer Society at cancer.org/breast cancer screening or call 1-800-227-2345.
Emily Engberg is sitting in for Elizabeth Reese today. Okay, let's just call it like it is. Dealing with acne as a teen, that's brutal. It's actually the most common skin problem in the United States, affecting more than 40 million people. And acne scarring can stick with you for the rest of your life.
Yeah, but a new treatment at Simon's Salon and Spa could help those scars heal and soften dramatically. In today's Be Well with TCL, reporter Kelly Hansen shows us how the Skin Pen works.
The Skin Pen is a microneedling device. So what you're doing is you're making hundreds to thousands of tiny punctures in the skin to start the wound healing response.
Skin Pen is the only microneedling device in the world cleared by the U.S. Food and Drug Administration, and Haley Fee is the local Skin Pen expert.
I tell people to plan to do between 3 and 6 treatments, 4 to 6 weeks apart.
Estheticians at Simon's Salon and Spa start by cleansing the face and then applying a topical numbing gel.
These make very tiny little microscopic punctures that aren't visible to the naked eye. There's no tracking.
This tool is designed to help regenerate the skin, targeting and softening acne scarring by remodeling the tissue.
You're going to see it soften. You're going to see them become less pronounced over time, and the improvement varies, from patient to patient, how much age, ethnicity, how deep the scarring was.
There's also minimal downtime, just no makeup or sun exposure for 24 hours.
Your skin's going to look flush, and it's going to feel kind of warm, and so you're going to leave looking a little pink or like you were in the sun, and then you're going to notice over that 24-hour period of time that flushing start to dissipate.
There's
Seems
nothing
easy
better.
enough,
Yeah, and
right?
there's nothing better than feeling good. There's something, it's not just about looking good, you feel good.
Right.
And then your confidence, all that stuff, I like that.
Hi lovelies! So a few weeks ago I shared some of my very favorite homemade broth recipes and you guys seem to really enjoy it, but in the comments section I got a lot of questions about bone broth. Now bone broth is very trendy right now. It's super high in protein, really healthy, and it's really easy to make. So I did some research and I've done some testing, and today I'm sharing a great bone broth recipe with all of you. Now, of course, as the name suggests, to make bone broth, you need to start with some bones. Now, I've seen this done with lots of different types of bones, but the classic is made with beef bones. So I found mine in my supermarket. You can usually, though, just ask your butcher. They'll definitely have some that they're trying to get rid of. They're actually really inexpensive, so that is not bad at all. One important step when you are making a bone broth like this is roasting your bones. Now, it's not essential in terms of getting a bone broth happening, but it is going to help develop the best flavor. So we're just going to arrange our bones on a baking sheet. And then to amp up the flavor even more, we are also going to roast our vegetables. Now this is an optional step, but I think roasting vegetables definitely helps bring out the best flavors. I'm going to add some leeks, some carrot, some celery, some onion, and some garlic. As you can see, I've chopped everything really roughly. You don't have to be fussy about it. All of this is going to be simmering for between 10 and 12 hours. So just get them on the pan and get them into the oven, and we'll just bake these for about 30 minutes or so. We have developed a ton of flavor by roasting all of this beforehand. Now we can transfer it all to our slow cooker. Now, you always have the option to do this in a soup pot, but we are going to be simmering this for between 10 and 12 hours. So slow cookers, I think, are the better tool for the job because you can kind of set them and forget them, whereas leaving your stove on for that long kind of just makes me a little nervous. So slow cooker it is. To add even more flavor to my broth, I'm going to throw in a big handful of fresh parsley. I've got some fresh bay leaves. I've also got some whole peppercorns I'm going to toss in here, a good amount of salt, and some water. It should be said, bone broth is considered a sipping broth. So instead of cooking with it or using it in a soup recipe, most people will actually just sip it hot as it is. So you really do want to add as much flavor as you possibly can, because you are going to really taste it. Once we've got this all topped up with water, we're just going to put our lid on and then set our heat to low and let this cook for between 10 and 12 hours. Yes, it seems like a long time to wait, but you have to remember the secret to the nutrition in bone broth is really slowly extracting all of the amazing nutrients and vitamins hidden within the bone. 10 to 12 hours later, your patients will be rewarded. What you'll end up with is a nice, savory, rich broth. I'm just going to finish this off with a few splashes of apple cider vinegar to add some much needed acidity. And then all you'll need to do is strain it at this point and skim the fat. Bones like this often render a lot of fat, so you may find it easier to allow your broth to cool completely, and then you can just really easily skim the fat off the top with a spoon. Totally up to you though. Once you've got that fat removed, you can store this in the fridge for up to 3 days or in the freezer for up to 3 months, and then just use it as you need it. Bon appetit! I really hope you guys found this tutorial helpful, and if you have any other questions about bone broth, don't hesitate to leave them in the comment section below. I will do my best to answer as many as I possibly can. And of course, if you give this a try, be sure to tweet me, Instagram me, or Snapchat me a photo, because you know I always love seeing your creations. If you're looking for more great homemade broth recipes, I've got a ton of them on the channel, so take a look for those. And finally, if you haven't already, be sure to subscribe, because there is lots more deliciousness where this came from.
There's no one single test that rules in or rules out risk. There's a whole host of well-known, well-described metabolic factors that now the Boston Heart Lab can uncover for us.
One of the reasons we founded Boston Heart was to provide better testing to doctors so that they could treat their patients better.
We know that it's more than just understanding a test result, that if we want to make real change with patients and outcomes, then we've got to get to someplace different with the patient engagement.
Our program is a really unique combination of both diagnostics and also lifestyle program that takes that patient to the next level of not just understanding their lab results, but also giving them a program to take action and to move forward in improving their heart health.
Utilizing advanced biomarkers actually helps to identify disease early on.
We started in this area of identification, right? Better risk assessment with better science behind what we do.
Our testing helps the doctor treat their patients better. All the tests that we have are what we call actionable. We also make sure the doctor doesn't miss anything. We make sure they don't miss liver disease or thyroid disease or kidney disease before they try to treat the cholesterol in a patient.
Residual risk is really the dirty secret of cardiology for many, many years.
We know, you look at all the major statin trials that we've got, from TNT to Jupiter, at most you get a 30% relative risk reduction.
What we don't talk about is the other 70% who have taken a statin drug and yet still have their heart attack or stroke.
The tools that we have been given from Boston Heart Diagnostics gives us exactly the tools we need to address the additional 70% of risk that's out there to our patients.
Boston Heart provides a very quality product. Their quality control and their precision in giving you the specific answer you need is unmatched.
Boston Heart is redefining the role of the laboratory in patient care. Heart disease is complex, and it has many causes. So taking a combination of our advanced diagnostics and combining that with patient preferences for exercise and nutrition, we're actually able to individualize care to patients and deliver it to them in a way that they understand. It hasn't been done before.
Boston Heart has a tremendous way of providing a document to give to your patient so that the patient can specifically go back and look and see, oh, this area I've got to fix.
Patients understand colors. It makes it quick and easy to decipher, and also explain to patients what therapy changes need to be made.
The personalized treatment plan is an absolutely essential component and something that only Boston Heart Diagnostics gives you. Having that tool available to us allows us to then say what we need to say in the office, implement the therapies that we need to implement, but then the patient goes home and has a booklet that reinforces everything they were told in the office. And they're able to digest it over time, again, helping their compliance. Patient understanding equals compliance.
So the whole third piece of what we've been doing and what the last year has been about for us has been integrating all of these things to engage patients.
In the Boston Heart Lifestyle Program, not only do you get a personalized, individualized eating strategy, but you have access to coaching, because we know that having the information is not enough to get the job done in all cases.
All right, so here's our first case. This is a youngster, a female, age 50. Here we've got our first set of results. Here we've got the second. There's some improvement, but really, she still has a lot of work to do. The doctor enrolled her in the Boston Heart Lifestyle Program, where she's got tools, support, coaches. She really did not want to go on a statin, so she's very highly motivated to follow the program. She used our portal. She recorded her food and her exercise very religiously. Just look at her now. Look at those results. This is what a highly motivated, compliant patient can do in just 6 months. It's amazing, right?
We've got a game-changing approach that is really going to make a difference in people's lives.
We think it makes our company special.
It's revolutionized how I practice medicine.
The lab, Boston Heart Diagnostics, has changed patients' lives.
Did you know an estimated 528,000 cervical cancer cases are diagnosed worldwide each year? 12,000 cases in the United States alone. Cervical cancer is caused by human papillomavirus, or HPV. About 70% of cervical cancer cases in the U.S. are caused by HPV types 16 and 18. HPV is a common virus. There are an estimated 79 million HPV infections in the U.S., including more than 14 million new HPV infections per year. Most infections clear on their own, but persistence of some can lead to cervical cancer and other significant diseases. There's no way to predict who will or won't clear the virus. Most cases of cervical cancer can be prevented. Talk to your healthcare provider. January is Cervical Health Awareness Month. For more information about HPV and cervical cancer, visit hpv.com.
Did you know that when a woman becomes pregnant, her blood contains some of her baby's DNA? This means a blood sample from a pregnant woman can tell us the chance that her baby has certain health conditions, like Down syndrome. These types of conditions most often occur by chance and are not inherited. Most of the time, we'll find that the chance the baby has one of these conditions is low. But even if the chance is high, we believe it's good to know this information about your pregnancy. My name is Kayleen, and I'm a certified genetic counselor. It's important, both to me and to my entire team, that you feel comfortable with the information you request from Counsel. In the next few minutes, I'll go through some information about the Counsel-Informed Pregnancy Screen. If you find yourself wanting more information than I cover in this video, you can speak with your healthcare provider or contact us at counsel.com. The Counsel-Informed Pregnancy Screen can tell you the likelihood that your baby has certain chromosome alterations. A chromosome is a large collection of information inside our cells, which contains many pieces of DNA called genes. I like to think of a chromosome like a cookbook, and each gene is like a recipe within the cookbook. Our chromosomes contain thousands of genes, or recipes, that instruct our bodies how to grow, develop, and function. The typical number of chromosomes in our cells is 46, 23 from each parent. Our chromosomes are numbered from 1 to 22, and the final pair determines sex. The most common chromosome alterations involve extra or missing pieces of information, which can interfere with the body's typical development. For example, Down syndrome is a condition that occurs because of an extra copy of chromosome number 21. Another condition, called trisomy 18, occurs because of an extra copy of chromosome 18. Chromosome alterations may cause physical or intellectual disability, but the severity can vary depending on the alteration. The entire list of conditions that can be included in this screen can be seen at Counsyl.com. Your doctor may only test you for a subset of conditions on the Counsyl-informed pregnancy screen, so it's important to understand what's included in your specific screen. While most people will receive reassuring news, some will get a positive result, which means there's a greatly increased chance the pregnancy has a chromosome alteration. While the Counsyl-informed pregnancy screen is highly accurate, it's important to understand that if you receive a positive result, the next step typically involves confirming the result with a medical procedure, such as chorionic villus sampling or amniocentesis. If you test positive, we encourage you to speak with a member of our clinical team or your doctor about the next steps. If you are interested in knowing the sex of your baby, the Counsyl-informed pregnancy screen can provide this information. As I mentioned earlier, the final pair of chromosomes determines sex. Women have 2 X chromosomes, while men have 1 X chromosome and 1 Y chromosome. The main reason to look at the sex chromosomes is because alterations in these chromosomes can cause certain health conditions, just like alterations in any of our other chromosomes. For example, Turner syndrome is a condition that occurs because of a missing X chromosome. Again, the entire list of conditions that can be included in this screen can be seen at Counsyl.com. You should discuss with your doctor which conditions are included in your specific screen. The Counsyl-informed pregnancy screen is designed to detect conditions which occur by chance and does not screen for cystic fibrosis, Tay-Sachs disease, spinal muscular atrophy, or other inherited conditions. Screening for inherited conditions is included in the Counsyl Family Prep Screen, which looks at your and your partner's DNA rather than your baby's. Please see Counsyl.com for details about the Family Prep Screen. The Counsyl-informed pregnancy screen can only be performed on a blood sample during pregnancy. It can be done as early as 10 weeks after the first day of your last period or 8 weeks after conception. While the Counsyl-informed pregnancy screen is highly accurate, it cannot eliminate the chance to have a baby with a chromosome alteration, and any results you receive are only applicable to your current pregnancy. The results do not apply to future pregnancies. In general, this screen is included with most insurance policies, but coverage may depend on your personal and family history. It's important to understand that the Counsyl-informed pregnancy screen is one of many prenatal screening options available to you. If you have specific questions or concerns, you may wish to speak with your healthcare provider or a local genetic counselor about all of your options. To find a local genetic counselor, visit the National Society of Genetic Counselors at nsgc.org.
so many of my patients come to me because they first start to notice that their face just looks sort of older or more tired than they feel. Every time that you frown, every time that you show concern or even squint, basically you're contracting muscles in your face. So if you start to notice those frown lines between your eyebrows and they're bothering you, then it might be worth trying Dysport.
I've been wanting to try Dysport for a while because I think the frown lines between my eyebrows make me look older, but I'm a little concerned about the procedure. Does the process hurt?
I tell my patients, Dysport basically feels like a couple of pinches. It's actually much easier to get through a procedure of Dysport than it is to have your blood drawn. You know, the needle that people use to get their blood drawn in their arm is way bigger than that tiny little needle that I use to inject Dysport. By the time you notice the pinch, it's basically over.
I've never used Dysport, but I'd like to give it a try. My concern is this: will my face look frozen? How does the process work?
Dysport does not make your face look frozen. Dysport and the other forms of botulinum toxins, they all work the same way. They all inhibit the release or stop the release of a molecule called acetylcholine. And in doing so, they prevent your muscles from creating a frowning action. So Dysport actually just relaxes the muscles that make you look angry or tired. So you're perfectly capable of expressing your face the way that you normally would, except you just look a little bit more well-rested or refreshed.
I was just wondering how long the whole process would take.
The Dysport procedure usually takes me anywhere from 10 to 20 minutes. It's truly a lunchtime procedure. You know, as soon as you're done, you may notice these tiny little, almost mosquito bite looking blebs in the skin, and those are gone by the time that you walk out of the office. So really no one's gonna know that you had the procedure done.
I've had Dysport. I love how I look. How often do I have to do it to maintain the results?
Well, most people tend to want to repeat their Dysport procedure about every 3 to 4 months. And when they do come, the results that they get are very comparable to results that they got the first time that they got treated. I think that's what makes Dysport so amazing. It's just sort of the best version of you.
Dysport is a prescription injection for temporary improvement in the look of moderate to severe frown lines between the eyebrows, glabellar lines, in adults less than 65 years of age. Important safety information. What is the most important information you should know about Dysport? Spread of toxin effects. In some cases, the effects of Dysport and all botulinum toxin products may affect areas of the body away from the injection site. These effects can cause symptoms of a serious condition called botulism. Symptoms of botulism can happen hours to weeks after injection and may include swallowing and breathing problems, loss of strength and muscle weakness all over the body, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, trouble saying words clearly, or loss of bladder control. Swallowing and breathing problems can be life-threatening, and there have been reports of death. The risk of symptoms is probably greatest in children treated for muscle spasms, but symptoms can also occur in adults treated for muscle spasms and other conditions, particularly in those patients who have underlying conditions that would predispose them to these symptoms. The toxic effects have been reported at doses similar to those used to treat muscle spasms in the neck. Lower doses, in both approved and unapproved uses, have also caused toxic effects. This includes treatment of children and adults for muscle spasms. These effects could make it unsafe for you to drive a car, operate machinery, or do other dangerous activities. Do not have Dysport treatment if you are allergic to Dysport or any of its ingredients. See the end of the medication guide for a list of ingredients. Are allergic to cow's milk protein, had an allergic reaction to any other botulinum toxin product, such as Myablock or Botox, or have a skin infection at the planned injection site. The dose of Dysport is not the same as the dose of any other botulinum toxin product. The dose of Dysport cannot be compared to the dose of any other botulinum toxin product you may have used. Dysport may not be right for you if you have surgical changes to your face, very weak muscles in the treatment area, your face looks very different from side to side, the injection site is inflamed, you have droopy eyelids or sagging eyelid folds, deep facial scars, thick, oily skin, or if your wrinkles can't be smoothed by spreading them apart. Tell your doctor all about your medical conditions, including if you have a disease that affects your muscles and nerves, such as amyotrophic lateral sclerosis, ALS or Lou Gehrig's disease, myasthenia gravis or Lambert-Eaton syndrome, allergies to any botulinum toxin product or had any side effect from any botulinum toxin product in the past, a breathing problem such as asthma or emphysema, swallowing problems, bleeding problems, diabetes or a slow heartbeat or other problem with your heart rate or rhythm, plans to have surgery, had surgery on your face, weakness of your forehead muscles, such as trouble raising your eyebrows, drooping eyelids, or any other change in the way your face normally looks. Patients with a disease that affects muscles and nerves who are treated with typical doses of Dysport may have a higher risk of serious side effects, including severe swallowing and breathing problems. Human albumin. This product contains albumin taken from human plasma. Steps taken during donor screening and product manufacturing processes make the risk of spreading viral diseases extremely rare. In theory, there is also an extremely rare risk of contracting Creutzfeldt-Jakob disease, CJD. No cases of spread of viral diseases or CJD have ever been reported for albumin. Allergic reaction to injecting in the skin. It is not known if an allergic reaction can be caused by injecting Dysport into the skin. The safety of treating excessive sweating with Dysport is not known. Common side effects. The most common side effects are nose and throat irritation, headache, injection site pain, injection site skin reaction, upper respiratory tract infection, eyelid swelling, eyelid drooping, sinus inflammation, and nausea. Tell your doctor all about the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal and other natural products. Using Dysport with certain other medicines may cause serious side effects. Do not start any new medicines while taking Dysport without talking to your doctor first. Especially tell your doctor if you have received any other botulinum toxin product in the last 4 months, have received injections of botulinum toxin such as Myablock, Rimabotulinum toxin B, or Botox, Onabotulinum toxin A in the past. Be sure your doctor knows exactly which product you've received. Have recently received an antibiotic by injection, take muscle relaxants, take an allergy or cold medicine, or take a sleep medicine. Use in specific populations. Dysport should not be used in children or in women who are pregnant or breastfeeding. Ask your doctor if Dysport is right for you. You're encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see Dysport full prescribing information, including medication guide.
I'm Dr. Carl Thornfeld. I'm a practicing dermatologist, and I'm the founder of EpiSciences. Epionce differs from the other skincare lines out there because we're built from the ground up. The goal was to help me be a better doctor so that we could get people cleared faster, keep them clear, without having them have to suffer pain to get the gain. We've shown that that's not necessary anymore. We created products that we have proven in blinded clinical studies are effective and safe. We also use unique ingredients. We do all of our own manufacturing. And finally, I practice every day, so I'm being held accountable to patients. Therefore, my continual process is to make Epionce the best product line in the world today. In a nutshell, Epionce is simple, effective, and proven.
Refresh your skin with Laser Skin Renewal. Unveil your radiance by improving the appearance of age spots, sun damage, or wrinkles. Pulses of laser light deliver energy deep into the skin, targeting pigment and stimulating collagen, leaving you with a smoother, more even skin tone. Each treatment takes less than 30 minutes, with no downtime. Easily clear skin imperfections on your face and body. Find out if Laser Skin Renewal is right for you.
Today in the United States, an estimated 50 million women have reached menopause, and most women will spend at least 1/3 of their lives beyond their final period. There's some confusion among women and their healthcare practitioners about the range of available treatments. A recent survey found that only 23% of women say they're aware of all available treatment options for menopause-related hot flashes, and that only 10% of women have discussed non-hormonal treatment options with their healthcare practitioner. Well, hormone replacement therapy is a conventional way to treat hot flashes, and it's probably the most well-known type of therapy. However, not all women feel comfortable using hormones, and not everyone's a candidate for them. Some of the most popular non-hormonal therapies include black cohosh, red clover, evening primrose oil, and soy. The degree of relief with these popular approaches varies considerably, and they may not work for everyone. Another non-hormonal treatment that I often recommend to patients is Estrovera, featuring ERR-731. This has been demonstrated in clinical studies to significantly reduce menopausal symptoms, including hot flashes and mood issues. I strongly encourage women to discuss the various options with their healthcare practitioner. Together, they can determine which option is best for them.
I spent almost every weekend this summer either at the pool or at the beach, which is awesome, but what's not so awesome is how beat up my feet are now. Walking around in flip-flops and barefoot will do that. But that's why I am so pumped about this product. It is like nothing else you have ever tried on your feet, and it'll give them a total makeover. I first learned about this stuff from peoplestylewatch.com style director Andrea Labenthal. She tested it out for the site, and when I saw the results, I knew I had to try it. It's called Baby Foot because your feet will be baby soft after you use it. It's been around in Japan for like 15 years, but it's just now becoming a thing in the US. All right, here's the deal. The kit comes with these clear plastic booty-like things that you just slip over your feet. The bags come already filled with the exfoliant, so they're ready to go. It's filled with this liquidy, almost jelly-like substance that has tons of natural ingredients like calendula, ivy, grapefruit, sage, and no chemicals. And here's a little tip. The brand recommends soaking your feet for a few minutes before you even put the booties on. I've tried it and it totally makes a difference. So once you do slip the booties on, put a little of the tape that comes in the kit around the ankles to secure it. Once your little baggy booties are on, put your feet up, lean back, watch TV for an hour, and just let it all soak in. Then after an hour, take the booties off, wash your feet with soap, and you're done. You probably won't notice anything for the first few days, but by day 3, my feet were totally peeling. And then by day 5, it was like a full-on shedding situation. I know it sounds so crazy and it's really weird, but that's what's supposed to happen, so don't worry. And there's something really oddly satisfying about it. This will go on for a few days, but I promise it doesn't burn, it doesn't hurt, this is all supposed to happen. Once the shedding stops, your feet are going to be so smooth and so soft, like you've never felt them before. Your calluses will be totally less prominent, if not completely gone. Now I know what you're wondering, because I was wondering it too. What makes this better than a pedicure? Well, it turns out when you get a pedicure and they're scraping at your dead skin and filing away your calluses, that actually triggers more dead skin to build up and new calluses to form. It's a vicious cycle. Plus, when you get a pedicure, they're putting chemicals all over your feet, and this is all natural. Baby Foot is such a no-brainer. Try it today. It costs less than a pedicure, it does way more. I obviously already have Baby Foot for myself, but I'm getting one for my boyfriend too. He doesn't know it yet, but I think after he watches this video and sees the results, he'll agree.
So, your doctor told you it's time to schedule a mammogram. You probably have some questions, like, will this take all day? Will I have to hold an uncomfortable position? Okay, want to know what to really expect your first time? First of all, wear a two-piece outfit so you only have to remove your top. And give your beauty products the day off. Think of the X-ray machine as your friend. You'll give it a quick hug as it compresses your breast between two flat paddles. The machine will use a safe, low-dose X-ray to take multiple images of each breast. The paddles might be a bit cold, and you could be a little uncomfortable, but the good news is, the procedure only takes about 20 seconds per image. And that's it. Schedule your yearly mammogram around your birthday so it's easy to remember. After all, taking care of your health is the best gift you can give yourself.
What is a mutation? It's a technical term for a sequence change in DNA. So DNA is the blueprint for all of the cells in our body. And the blueprint of DNA is made of chemical bases A, C, G, and T. And the blueprint is literally spelled out for our body using those 4 chemical-based letters. And we know what we expect a normal spelling to be for that blueprint. A mutation is really any change in those 4 chemical letters. We use the term mutation to have a negative connotation, right? A mutation may damage a gene, or a mutation may provide a negative outcome. But it technically means any change from those 4 chemical letters in the DNA. We know that research says about 10% of all cases of cancer are what's called hereditary in nature. And that means that someone inherits a gene mutation from either their mother or their father that predisposes them to some increased level of cancer risk. Cancer does tend to run in families, and families share the same environments, they share the same kinds of lifestyles, but we also know that they share the same genes. And genetic testing can now really definitively diagnose whether cancer is hereditary in nature versus just sporadically occurring due to lifestyle or environmental factors or from aging. There are certain red flags we would look for in someone's family history, which would include multiple cases of the same kind of cancer, younger ages of onset than we would usually expect, and a higher occurrence of more rare cancers than we would expect. Having a genetic test provides a definitive diagnosis of that increased risk for cancer. And it empowers people with their healthcare providers to take the necessary reactions to that increased risk. Things like increasing screening to try to detect cancer early, to measures that prevent cancer from occurring in the first place. We also know that with genetic testing, in any one family, some members inherit that mutation and other family members do not. So only with a genetic test could someone that has a family history of cancer really know that their risk is not increased if there's a mutation in the family that they did not inherit. The test is really a blood sample or a saliva sample that is then sent to us here at Myriad Genetic Laboratories. It takes us 14 days or less to do our hereditary cancer syndrome genetic testing, and then the results are reported back to the healthcare provider, and then the healthcare provider would have a discussion with the patient about what those results were and what course of medical action may be taken. The good news is that genetic testing for hereditary cancer syndromes is a covered benefit by most insurance companies. Every insurance plan is different, and we have an assistance program that helps patients look at what their covered benefits are and how much money they will have to pay out of pocket. But in our experience, most patients who are appropriate for testing pay $0 out of pocket for the genetic test.
Now to part 2 of our reboot camp, helping you get healthy this morning. And here to, it's a great book. He's the author of Happy Gut. Vincent, say it for me again.
Pedre.
Nice to have you here, doctor. And it is something about, why do you think it's so important to know about this?
So, Robin, in my clinical practice, the gut is the seat of all health. If you heal your gut, you can heal your body. So let's look at this picture here. Imagine your gut is an internal garden, and this rock wall here is the gut lining itself. You see how all the rocks fit nicely together. That's a healthy rock lining. On the other side is your microbiome. Those are the good guys, the good bacteria that keep the lining healthy. Back here, imagine this is the food that's getting digested and absorbed. And you want it to break down so you can absorb the tiny nutrients getting through. But imagine now you've been on antibiotics, you've been exposed to pesticides, toxins in the environment, and you get what we call a leaky gut. So the rock wall gets broken up.
Oh, I see.
And then food particles can get through, also toxins, maybe sometimes yeast, bacteria. This causes inflammation and that makes you feel lousy, you feel tired, you feel mentally foggy.
You just feel off. You just feel that's the kind of feeling that you have. But you have something, a 28-day program, and I love the acronym CARE. So let's start with the C. What does C stand for?
So C stands for cleanse. So first, we're taking out all the inflammatory foods. So some of the things you might not think of, well, we all know sugar is inflammatory, but wheat, dairy, corn, soy, and instead, we want to eat foods that are anti-inflammatory, so like dark leafy greens, berries, avocado, nuts, seeds, grass-fed beef, healthy oils.
So take that out for
That's going to reduce the inflammation in your body and make your gut healthy.
And what does the A stand for?
So A is for activate. So imagine if you hurt your knee and you needed to walk with a cane. The cane's assisting your knee so you can get better. Same way, digestive enzymes are going to help your gut get healthier, like these.
But you always see like 1 billion units or whatnot.
So you're talking about probiotics.
Yeah.
So let's move to R.
Okay.
So R is about restore. So cultivating this internal garden with prebiotic foods like asparagus, onions, garlic. But you might also take a probiotic supplement, or you might take a cultured food like a coconut water kefir, kimchi, cultured vegetables.
Okay. And E?
E is for enhance. So E is about healing the gut lining. Aloe, DGL, L-glutamine, these are nutrients, and if you do this whole system together, this is how you create a happy gut.
28 days, and then you can reintroduce things. And I found out doing this that wheat, I didn't even know that wheat was an issue that I had that I wasn't even aware of, and taking it out has made all the difference in the world. Hey, doctor, thank you very much.
Uncover touchable skin with laser hair removal. Bare your skin again and look your best with permanent hair reduction on all areas of your body. Energy is used to target and destroy the hair follicles responsible for hair growth without causing damage to the surrounding skin. Depending on the size of the area, treatment times range from 5 to 30 minutes, with no downtime and low discomfort. Get the touchable skin you've always wanted. Find out if laser hair removal is right for you.
The American Cancer Society is launching a new attack on cancer. We are using our passion, resources, and expertise to make HPV cancer history. Join our newest public health campaign, Mission HPV Cancer Free, to help prevent 6 types of cancer with the HPV vaccine. We have a bold goal to save lives by increasing preteen HPV vaccination to 80% by 2026. It's time to protect boys and girls from this cancer-causing threat. When you tell people about Mission HPV Cancer Free, you have science and credibility on your side. HPV vaccination prevents infections that can cause 6 types of cancer. HPV vaccination is cancer prevention. Just 2 shots are needed between ages 11 and 12. The vaccine is safe and effective. More than 270 million doses have been distributed worldwide over the last 10 years, and studies continue to show that HPV vaccination is very safe. Most parents are already vaccinating their kids. Over 60% of kids have started the HPV vaccine series. Our thousands of staff and millions of volunteers will help create the first generation free of HPV cancers. Join the movement to make HPV cancer history. Together, we will succeed. Learn more at cancer.org/HPV.
Tell me about being diagnosed with this, and then, I mean, it must have been really tough for you, because I know a lot of times people don't know that they have this, right?
Yeah, absolutely. So when I was 15, I had symptoms of endometriosis, but I didn't even know what endometriosis was. But, you know, for me, it was sort of like, I'm a dancer, I'm a tough cookie. I guess this is just what it's like for a woman to have periods, and not just in the menstrual cycle, but the entire month, and the pain. And so I was just, you know, I kept it to myself, and I didn't really talk about it because this was just normal, right? Wrong, it's not normal. And so as I was going through, you know, all these years, I had a roommate that had endometriosis, and she was telling me what it was. And, you know, her symptoms were like, well, that sounds like me. But endometriosis, what is that? That sounds way too complicated and medical, so it went right over my head.
Right, a big word with big problems.
Exactly. Right? So I, you know, I decided, I was like, well, I'm fine. And I, you know, just kept pushing through. And when I was on Dancing with the Stars, back when I was, I think, 19, 20 years old, I was dancing, and I remember in the middle of the routine, just like in the worst pain, like collapsed, fell over. My mom was actually there, and she's like, okay, Julianne, like quit being such a tough cookie, let's go figure out what is going on. So we actually ended up going to the hospital, and it took a few different doctors to figure out what was going on. And then they diagnosed me with endometriosis. I had surgery the next day, which of course, or the next week I had surgery, which of course is different for every woman, but that was very, you know, specific to my treatment that I needed, that was recommended by my doctor. And then, you know, for me, the outpour of just like response with women saying like, thank you so much for opening up about this. I have endometriosis, and nobody really understands or gets it. They just think that I'm being dramatic. And so it was sort of like an eye-opener, saying like, okay, well, I'm gonna not care what people think, and like not be so private about this, because if I can help one woman or 20 or 20,000, you know, I want to be able to at least bring some awareness to it.
Right, so they can identify the symptoms. The unfortunate thing, though, there is no cure for this. So what can be done to sort of manage?
Absolutely. Well, obviously, like, if you think that you might have endometriosis, going to the website meinendo.com is amazing, because it's actually one source that's really reliable with correct information, and you can, you know, check off symptoms if you may have them, but also like there's a symptom tracker, so you can do that and then go to your doctor and actually try to come up with a solution of you know, managing the pain. And there's medical and there's surgical, there's combination. I obviously have a combination of things that I do, but yeah, it's not a fun thing, but having the awareness and the understanding yourself, but also the people around you, is so much more of a relief than I think people realize.
And you're able to manage it within your life, and especially for you, you know, you're a working professional, you're about to get married. I mean, you have so many other stresses, so how are you able to sort of like, you know, take on the challenge of preparing for your wedding for that? You know?
Yeah. No, it's definitely something that I manage daily, and I have to check in with my doctor constantly. But it's, you know, it's part of my life, and I've accepted that it's that. And being able to talk openly about it, though, is great, because if I'm on a shoot or on set somewhere and people know that I have it, it's okay. They're not like, what's going on? She's like hunched over. I'm like, it's okay, it passes in like 30 seconds, I'll be okay. But I feel like I can do that without feeling like, oh, she's being dramatic or weak, or those notions that you think as a woman, you're like, I don't want to show that I'm in pain, even though we're tough as nails. So
let's just get that straight.
Exactly. So I think that just knowing that you can actually talk openly about it is such a relief, and yeah, and I mean, I still do what I love. I'm passionate about my tour that I'm about to go on. I'm doing Dancing with the Stars. I still live my life, and it's great.
This is Jack. And like most of us, he's dehydrated, especially after exercising. But thanks to Liquid IV's hydration multiplier, we can fix Jack faster than water by itself. How can that be? Science. In the 1970s, the World Health Organization developed a formula with an optimal ratio of nutrients that could enter the bloodstream more rapidly and efficiently than water alone. We call this process cellular transport technology, or CTT. Think of it as a high-speed railway in the body. CTT provides an expedited route for essential electrolytes, nutrients, and water to reach the areas that need it most. These nutrients are also absorbed earlier on in the digestive tract, meaning Jack's body can start feeling the positive benefits sooner. By targeting the bloodstream, Liquid IV delivers hydration rapidly to your cells, optimizing the benefits of water. How else does Liquid IV promote rapid recovery? More vitamin C than an orange, as much potassium as a banana. More than 3 times the electrolytes of leading sports drinks. In fact, Liquid IV helped Jack revive and restore his hydration levels. Now Jack is ready to conquer the world. Way to go, Jack.
Women, listen up. You need to pay attention to your heart health because your risk of cardiovascular disease is real. Mayo Clinic experts say knowing your heart numbers can help reduce that risk. Number 1.
They should know their blood pressure.
Dr. Sharon Hayes says ideal numbers are 120/80 and lower. Number 2, your lipid profile. We'll break that one down. LDL, or bad cholesterol, should be 100 or less. HDL, or good cholesterol, should be 60 or higher. Triglycerides, 150 or less. Number 3 is weight, a body mass index of less than 25.
Number 4 is steps. How many do you take every day?
This gets back to the physical activity, which is one of the most important things you can do.
Aim for more than 10,000 steps a day. Number 5, fruits and vegetables. Eat 5 to 9 servings every day. And number 6, sleep.
If you sleep less than 6 hours or greater than 9 hours, that may increase your risk of cardiovascular disease.
Talk to your healthcare provider about getting your numbers to where they ought to be. I'm Vivian Williams, and for more health news, visit the Mayo Clinic News Network.
My name is Dr. Peter Allring. I'm the Medical Director of Missouri Center for Reproductive Medicine, also called MCRM Fertility. I've been in the practice of women's health and women's reproductive health for about 30 years, and more specifically been in the world of infertility medicine for 20 years. We're very much into, at MCRM, the science and technology that has really availed itself of the field in the last 15 years. There's been tremendous advances that we've seen evolve over the last 15 years, and it's really been amazing. And applying these things to the clinical situations, very much what we're interested in, and trying to do so in a cost-effective manner. So this is why we are very much into assessing fertility aspects with fertility screening, which is a huge thing, is also getting into the egg freezing, oocyte cryopreservation, fertility preservation are very much interests of ours. Egg donation, embryo donation, male factor fertility also has been a burgeoning field in the last decade. All these things are focusing on science and technology, and being able to apply this to the patients is really our goal, to improve outcomes and achieve more pregnancies, and all doing so amazingly at lower cost. Being able to have patients afford these technologies has always been a big thing for us as well. So we're looking to the future, no question about it, and I think all of these things that we've been applying are really helpful.
MedFusion's patient portal makes it easy and convenient for you to securely communicate with our office, the way healthcare should be. You can use the portal anytime you want, from any device you want, to do things like request appointments or prescription refills, pay your bill, send questions to staff members, or complete forms. Check our portal to see what we offer. Getting started is easy. Just make sure our office has your current email address. When you receive a message from our office, just click on the button in the email and you'll be prompted to set up your portal account. Create your username and password, answer a secret security question, and your portal account is ready to use. The sign-in page features reminders and lots of information from your doctor's office, links, messages, and contact information. Once you sign in, the home page makes it easy to see what you can do in the portal. Some options you may see include view your secure messages, request an appointment, ask a question to someone on the staff, request a prescription refill, pay a bill, or fill out health forms that need to be completed. Once you click on an icon, just follow the portal's instruction and it will step you through what you need to do to complete your task. If it's easier for you to use the portal in Spanish, just click on the Español and the entire interface will convert to Spanish. If you have any questions or get stuck along the way, we offer patient chat. Just click on the orange bar at the bottom of the page and a MedFusion portal specialist will be right there to answer your question. MedFusion's patient portal makes working with our office much more convenient. The MedFusion Patient Portal, the way healthcare should be.
To prevent skin cancer, there's a number of things that people can do and change in their own lifestyle. And it's not
just not being outside. Certainly no one wants to just stay inside all day, but you can use sunscreen to prevent sunburns. What I tell people, at minimum you want SPF 30 or above. The incremental benefit from 8 to 30 is huge. So as long as you're using 30 or above and it has UVA and UVB coverage, then to me you're using the right sunscreen. But it is hard to use sunscreen correctly. So you got to remember, you got to put it on about 30 minutes before you leave the home. You want to put it on and let it be, and then you have to reapply. For most people, it's about every 2 hours, but some people need it even more often than that. If you're in the water, if you're exercising, you need it more often. I think that's the biggest mistake people make, is they're really great about putting it on before they go, but then you're having fun and all of a sudden it's 6 hours later and you have a sunburn. What I find more effective and easier, frankly, are really what we call barrier methods, which means sun shirts, hats, and just covering up. The other things is just not going to tanning beds, to be honest with you. I mean, tanning beds are intense amount of UVA rays, and that's really what we're trying to prevent. To discuss a little bit about how to monitor your skin, I would suggest, self-exams are actually one of the most effective ways. Paying attention to your moles and your skin, anything that's new, anything that's changing. I think once a month is more than sufficient. If you look at something every day, you won't really see a change. People talk about the A, B, C, Ds, and sometimes E's of melanoma. A is for asymmetry, so an irregular mole. B is for borders, so the borders don't look clear. C is for color, so variations in color within the mole. D is for diameter. If you have a mole that's greater than 5 millimeters, which is about 1/4 of an inch. E is for evolution, so an area that's changing over time. So it may have looked pretty normal and then starts to change. Seeing a dermatologist, especially if you're in that high-risk population, is very important. And even many primary care doctors are actually very good at looking at people's skin and knowing what's abnormal and what's not. Get into the gown. Everyone hates getting into the gown when they go to the doctor's office, but if you don't, no one's going to look and no one's going to see those areas that you might miss on your back and areas that you can't see.
Metagenics has always had many researchers behind those products. For many of the different supplements that Metagenics has used, they have actually been tried in clinical practice before they were offered for sale to patients. So it's really the combination of having one of the original quality control groups in the dietary supplement industry to make sure that they're safe products that are being produced and clean products, coupled with a clinical staff that has actually looked at the clinical value of those products before they're released to the public.
The level of quality here far surpasses anything I've experienced in my career. You can see it in the packaging where we still use a glass bottle. Why? Because glass is basically inert. You don't get any oxygen or moisture transmitting through a glass bottle. When a raw material comes in the door, it goes through a wide battery of tests. We test for potency, purity, and identity. We're screening for pesticides to a very low level, and we're using a very wide screen. It can go in raw material testing for up to 30 to 40 days.
It's ingrained into everything that we do. It's not just a matter of us making sure that we're manufacturing something properly. It's not just a aspect of making sure that everything meets specifications. You can create a very simple specification, or you can create a very robust specification. And our specifications are very robust. We have a lot of insight into our products and the materials that even our suppliers don't necessarily have.
All the testing that we do on all of our products is key to the success of our products.
Reset and renew. The clear change difference. Life is busy. You meet deadlines at work, never miss a get-together with friends, and always make sure your family is happy and taken care of. But what about you? Do you feel tired, bloated, have difficulty concentrating, or have muscle aches? Lifestyle factors such as stress, an unhealthy diet, alcohol consumption, or environmental factors like being exposed to pesticides or polluted air add unwanted compounds to the body. Your body is naturally designed to purify and get rid of toxins. But because of the volume of potentially harmful compounds that most people are exposed to on a daily basis, your body can become overburdened. That's why a metabolic detoxification program may be helpful for you. The safest and most effective program is one administered under the care of a healthcare provider. You may have heard of juicing or cleanses, but not all detox programs are safe. Trendy fad diets and juice cleanses can deprive the body of vital nutrients and make you feel even worse. When administered under the guidance of a practitioner, the Clear Change program is the solution for a safe, healthy, and gentle approach to getting back in balance and feeling more energized. Clear Change is a metabolic detoxification program that is scientifically designed, practitioner-supported, demonstrated to be successful for thousands of patients over 20 years, and contains high-quality ingredients that support the 3 phases of detoxification. The program includes everything you need to succeed: a shopping list and easy healthy recipes, Ultra Clear Renew nutritional formula with 12 grams of pea and rice protein, 20 vitamins and minerals, antioxidants, and activated broccoli powder. Advoclear capsules to enhance activities of the liver's detoxification enzymes, and daily emails to keep you motivated and help you finish strong. A handy shaker cup is included for convenience on the go. In as little as 10 days, many people report feeling healthy, re-energized, and on top of their game. Reset and renew with Clear Change, the most trusted, well-researched metabolic detoxification program available. Ask your healthcare provider if Clear Change is right for you, or log on to clearchangeprogram.com to find a healthcare provider today. These statements have not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease.
I can just suck up my endometriosis pain. Or I can keep apologizing. Or I can hope my pain gets better on its own. Or I can talk to my gynecologist today.
You didn't choose to have endometriosis, but you can choose to ask if Orilissa is right for you. Orilissa is specifically developed for women with moderate to severe endometriosis pain. In clinical trials, Orilissa was proven to reduce 3 common types of endometriosis pain: painful periods, pelvic pain in between periods, and pain with sex. Don't use Orilissa if you are or may be pregnant, have osteoporosis, severe liver disease, or are taking drugs like cyclosporin or gemfibrozil. It may cause abnormal liver tests. Orilissa may change your periods, making it hard to know if you are pregnant. It does not prevent pregnancy. Use birth control that does not contain hormones. Orilissa may cause suicidal thoughts or actions. It may also cause bone loss. Ask your gynecologist if Orilissa is right for you. Orilissa, made for endopain.
Women of a certain age, they do often struggle with the aggravating body issues that can accompany menopause. Like Melly, who has developed a hate-hate relationship with the dreaded M word.
Hi, Dr. Lisa. I've been having symptoms of early menopause for the last 3 years, and I've tried natural solutions, but guess what? They don't work. I never considered hormone therapies before, but I'm wondering if they're the way to go to keep my symptoms under control. Any advice?
Welcome, and thank you to Melly for your question. What type of symptoms have you been having?
I've been having hot flashes at night, trouble sleeping, and massive mood swings.
Okay, now that could even be PMS, all right? Are you still having periods?
No, I stopped 3.5 years ago.
Okay, have you had your hormone levels checked?
I have not, no.
Okay, because actually before, and how old are you?
I'm 43.
Okay, so you're saying actually it happened around 40 or maybe a little bit before.
Exactly, yeah.
All right, so anything before 40, we actually call premature ovarian failure, and it's actually not menopause. Okay. You actually have to find out why it's happening. So we check the hormone levels, because a lot of times thyroid problems can mimic this, even things, and not to scare you, things like pituitary tumors can also mimic these things. We put this under the category of amenorrhea, or not having your periods. Okay? Now, just for the sake of this conversation, say it was the M word, as you say, menopause. And what you have to realize is it's a way of looking at it. Menopause is not a disease, it's not a problem, it's a natural process. And menopause actually means when you stop your period for a year, okay? After at that time when your hormones are at the right place. And that usually the average age is about 50 to 51. Prior to that time is perimenopause. You could consider almost any woman over 35, listen up ladies because it may freak you out, in perimenopause, okay? Because what it means is that the estrogen levels are falling, the ovaries are starting to sputter a little bit. They're not doing their job. Now, hormone replacement therapy, that only starts when you're in menopause, because once you're having periods, then it's about contraception, because contraception and hormone replacement have the same hormones, estrogen and progesterone. Now, the other thing that happens with menopause, though, is sometimes the testosterone goes down as well, and we need to supplement that. That's where a lot of women have heard about this thing called pellet therapy. So let me show you how the pellet works, all right? Because this is a great new thing that that women are looking at, and actually men as well. Now, it's usually placed in the hip, so we make a little sterile area right around the hip, and we give a little local lidocaine to numb that area. Then we place we make a little incision there, and then we place a trocar, which is a little hollow tube that has the medication in it. We put the little pellets into the trocar, and depending on the dosage will depend on how many pellets go in there. They're placed subcutaneously, so underneath that first layer. And again, depending on the number of dosages there are, pellets will give you different dosage. And that puts out a sustained release of estrogen and testosterone. And again, this is just estrogen and testosterone. You will need a different form of progesterone to balance out the uterus, because the uterus has to be protected. So very complicated as it is, and that's why you have to consult with your gynecologist. And you have to see your gynecologist regularly around this time, because this is the time that breast cancers come up, medical diseases come up, uterine cancer, cervical cancer. That's why you need your pap smears, all these things to continue.
Okay.
Right, so you're going to go see your doctor.
I will, I promise. Thank you very much.
Now, the only thing that we do have to preface about the pellet is it is made by a compounding pharmacy. And there are compounded hormones. It's not necessarily natural. You can get natural FDA pharmaceutical hormones as well. But the compounded ones, you have to be careful of knowing which pharmacy you go to, because they're not FDA regulated, and there have been some, instances with infections and fungal meningitis. So you do have to be very careful about compounded hormone replacement therapy. Just make sure you know your compounding pharmacy. We're not saying this is a bad thing at all, because they can actually give you dosages which may not be available in the pharmacies.
It sounds like it's time to make a phone call.
I will,
right?
I promise. Thank you.
Thank you for coming on.
Your healthcare organization has invested in Phreesia to give you a more modern, streamlined experience. Phreesia offers several different ways to automate the check-in process and meet the needs of you and your healthcare provider. Mobile, which allows you to pre-register for your appointment from the privacy and convenience of your own computer or device via a check-in link in a text message or email. The Phreesia Pad, which provides a private, secure in-office check-in experience. And Arrivals, which is ideal for patients who have frequent appointments. With Phreesia, you can review your information, complete forms, and pay copays and balances all on our secure platform. And because the information you enter into Phreesia is immediately available for your doctor to review, you can have more meaningful conversations in the exam room. Phreesia, committed to making healthcare better.
During pregnancy, your body realizes that there is a little foreign person living inside of your body. And so the body does all kinds of things to try to make sure that it doesn't fight that little foreign person that's living there. But the problem with that is it also means that you can't fight things like the flu as well as you could if you weren't pregnant. I think the number one thing to know is to be up to date with your vaccinations before getting pregnant. And that's really important because there's certain vaccinations that are not safe in pregnancy, such as rubella or the chickenpox vaccine. So if you are not immune to rubella or to chickenpox, then we wait until after pregnancy and then do the vaccination at that point. Now let's talk about the immunizations that you should think about getting during pregnancy, and there are two main ones. The first is the flu. It's safe to get at any point in pregnancy, and you actually get a double benefit because it both helps and protects mom from the flu, and even if you did get it, you're going to get a much milder form of it. And it also protects the baby because the baby isn't going to be able to get that vaccination until they're 6 months old. The second vaccination to get is pertussis. We recommend getting that between 27 and 36 weeks of pregnancy, and you might say, you know what, I already had that vaccination, and it doesn't matter. We still recommend getting it during pregnancy because for a couple of reasons. One is that we all got that vaccine when we were little for the most part, but immunity for that vaccine tends to wane over time. So there have been lots of whooping cough or pertussis outbreaks in little babies, and where are they getting it from? Their direct caregivers. So mom should get it during each pregnancy during that time frame because it's going to provide protection for both mom and baby because that baby isn't going to be able to get that vaccination until they're 2 months old. So you're going to pass along some of your immunity to the baby. And then the other thing is any person providing direct care for the baby, so dad, grandparents, close family friends, babysitter, also should be up to date with that pertussis or that whooping cough vaccine.
Hi, I'm Angela Lechterhand, and I'm the Immune Foundation's brand manager at Orthomolecular Products. In today's supplement spotlight, I'm going to talk about Cynatrol and Natronex, two natural solutions for immediate sinus and upper respiratory support. When people have sinus challenges, they may reach for over-the-counter options for quick relief. However, there are natural alternatives that can be extremely effective if you know what to look for. Here are the top criteria to keep in mind when choosing natural support products for sinus and respiratory challenges. 1. You want to see a label including all natural ingredients that contain standardized amounts of active compounds. For example, with Andrographis, an immune support herb, the active compound is andrographolides. To ensure adequate amounts of that compound being present, the label will say standardized to 30% andrographolides. Without this, it's impossible to say how much active compound is present. 2. They will help maintain normal inflammatory balance by using herbs like turmeric. 3. They maintain normal microbial balance without harming healthy bacteria in the body by including herbs such as thyme and berberine. 4. They include ingredients such as N-acetylcysteine to soothe the respiratory tract and improve mucus clearance. Cynatrol is an adult sinus and upper respiratory support product available in a convenient 12-capsule blister pack or a 60-count bottle. For children, we offer Natronex, an alcohol-free, non-drowsy formula. Just like adult formulations, we want to address 1. Microbial balance with herbs such as echinacea and elderberry. 2. Mucus clearance with ingredients like thyme and anise. And 3. Throat comfort by using an herb such as sage to soothe lung and throat tissues. Natronex is a great tasting liquid formula free from any artificial flavors or colors. It's available in a 120 milliliter bottle. And please remember these criteria when choosing natural sinus support products and consider Cynatrol and Natronex when addressing sinus and upper respiratory challenges.
In just one decade, so much can change. Hairstyles, fashion, graduation, first jobs, marriage, kids. But for a woman with endometriosis, up to 6 to 10 years can mark more of the same. The same pain, the same coping, the same silent suffering. That's because it can take up to 6 to 10 years to be diagnosed with endometriosis. The chief symptom of endometriosis, pelvic pain during or between periods, is thought of as just that, pain related to periods. But the reality is that endometriosis is painful, period. Other symptoms, pain during or after sex, painful bowel movements, pain in the intestine or lower abdomen, heavy periods or spotting between periods, may or may not be present. Some women with endometriosis may have no physical symptoms at all. Women may hear from well-meaning supporters things like, "That's normal period pain." Your pain is simply part of being a woman. Women may be feeling many things in what seems like a never-ending cycle of seeking help and coping, even if it's difficult to talk about. They strive to achieve a state of normal, but the feeling that something isn't right, that what they're feeling isn't normal, helps women persist. Once diagnosed, there's relief. Relief at knowing what's wrong. But something else enters the mix too, fear, and weighty decisions in the near term. All of this may happen in the 6 to 10 years it can take to get an endometriosis diagnosis for the 1 in 10 women of reproductive age who may have it. Odds are you know someone with endometriosis. Odds are greater that you have no idea how it affects them.
Hi, I'm Angela Lechterhand, and I'm the Immune Foundation's brand manager at Orthomolecular Products. In today's supplement spotlight, I'm going to talk to you about Virusid and Immumax, two natural solutions for immediate immune support. Immune challenges present year-round, and people want an effective solution. Here are the top criteria to keep in mind when choosing natural support products for immune challenges. 1, they include all natural ingredients such as elderberry, echinacea, and andrographis. 2, they help maintain normal inflammatory balance with herbs like turmeric. 3, they maintain normal microbial balance without harming any healthy bacteria in the body. And 4, they provide building blocks essential for immune system function by including high doses of certain vitamins and minerals, like vitamin A, C, and zinc. Virusid's synergistic formula significantly boosts immune cell function. This formula also helps soothe throat irritations and nasal secretions and helps maintain normal inflammatory balance by increasing antioxidant levels throughout the body. Virusid includes a powerful combination of key nutrients and botanical extracts that provide immediate support for immune challenges. Virusid is available at a convenient 12-capsule blister pack and a 60-count bottle. For children, we offer a liquid immune support product called Immumax. Immumax provides 2 key botanicals that strengthen antioxidant reserves and support the immune system. Immumax contains echinacea, one of the best-known botanical supplements used to boost the immune system, and propolis, which helps balance microbial activity and maintain normal inflammatory balance. Research has demonstrated Immumax helps protect kids' immunity during the winter months when immune challenges are prevalent. Of 328 children who completed one particular study, those in the Immumax group experienced a decrease in upper respiratory challenges as well as a decrease in duration of these challenges. Children in the Immumax group also had fewer days absent from daycare, fewer unscheduled physician visits, and significant improvement in throat irritations and general immune response. Immumax is available as a 250 milliliter bottle in a great tasting berry flavor that kids are sure to love. Remember these criteria when choosing natural immune support products and consider Virusid and Immumax when addressing immune challenges.
Functional medicine is a science-based whole systems approach looking at the fundamental underlying causes of clinical symptoms. We're looking for not what is wrong with this person, but why this person has an issue.
It's not alternative medicine, it's not an either or. It's simply taking some of the new findings from systems biology and how all kinds of different influences can impact a person's health.
When you can understand the underlying causes of the disease versus just diagnosing the disease itself, you can have expanded options on how to treat that disease.
So many other practitioners are looking at what are the symptoms and what do I quickly do to treat those symptoms. I'm much more interested in what happened, what created that problem to begin with, and that's really what functional medicine is all about.
When it comes to the patient outcomes and what I've seen for them is that they can appreciate the idea that I'm looking at them as an individual.
Getting from the patient through their own words, their experience. We now know that genes plus experience creates the phenotype that we live in the world. So we have to understand where the person is coming from.
We are looking at the way the body works in systems versus focusing on just a disease.
We're looking at genetics, toxicology, nutrition, psychospiritual issues, trauma, the whole big picture.
This gives us a set of tools that we can use to work with patients in a very systematic way when they've got a chronic problem to help unravel the cause of that problem and then address those underlying causes.
And you're giving them the roadmap, you're giving them the instructions, you're giving them the algorithm about how they can help themselves. You are engaging them as active participants in their care.
So the way that it's organized, the way that it's put together will give everyone that ability to change that patient's life for good.
"75% of Americans are chronically dehydrated, and it has a bigger impact than you think. Fatigue, headaches, confusion, all symptoms of being dehydrated. Caffeinated and sugar-filled beverages like sports drinks, juices, coffee, soda, and alcohol actually dehydrate the body even more. The answer? Liquid IV, a healthy, all-natural rehydration beverage that promotes rapid recovery. Liquid IV utilizes oral rehydration therapy, a precise ratio of ingredients that enter the bloodstream more rapidly than plain water. The 100% all-natural formula contains 5 essential vitamins and more than 3 times the electrolytes of leading sports drinks. Liquid IV has more vitamin C than 3 oranges and more potassium than an entire banana. Liquid IV's proprietary blend is specially designed to aid in the body's natural process of eliminating toxins. Trusted by thousands, Liquid IV is the perfect choice for anyone with an active lifestyle. Used by professional athletes to recover from extreme physical exertion, traveling business executives for jet lag, and partygoers to remedy the dreaded hangover. Get Liquid IV. Put an end to your dehydration. What are you waiting for?
Bare your legs again with laser leg vein removal. Laser leg vein removal is a fast and easy way to beautify your legs. Laser light targets and constricts the blood vessels in the leg without harming the surrounding tissue. You will see improvement in your leg veins immediately following treatment. Treatments are quick and easy, with no downtime and very low discomfort. Don't cover up. Bare your legs again. Find out if laser leg vein removal is right for you.
Hi, I'm Angela Lechterhand, and I'm the Immune Foundation's brand manager at Orthomolecular Products. In today's supplement spotlight, I'm going to talk to you about Virusid and Immumax, two natural solutions for immediate immune support. Immune challenges present year-round, and people want an effective solution. Here are the top criteria to keep in mind when choosing natural support products for immune challenges. 1, they include all natural ingredients such as elderberry, echinacea, and andrographis. 2, they help maintain normal inflammatory balance with herbs like turmeric. 3, they maintain normal microbial balance without harming any healthy bacteria in the body. And 4, they provide building blocks essential for immune system function by including high doses of certain vitamins and minerals like vitamin A, C, and zinc. Virusid's synergistic formula significantly boosts immune cell function. This formula also helps soothe throat irritations and nasal secretions and helps maintain normal inflammatory balance by increasing antioxidant levels throughout the body. Virusid includes a powerful combination of key nutrients and botanical extracts that provide immediate support for immune challenges. Virusid is available at a convenient 12-capsule blister pack and a 60-count bottle. For children, we offer a liquid immune support product called Immumax. Immumax provides 2 key botanicals that strengthen antioxidant reserves and support the immune system. Immumax contains echinacea, one of the best-known botanical supplements used to boost the immune system, and propolis, which helps balance microbial activity and maintain normal inflammatory balance. Research has demonstrated Immumax helps protect kids' immunity during the winter months when immune challenges are prevalent. Of 328 children who completed one particular study, those in the Immumax group experienced a decrease in upper respiratory challenges as well as a decrease in duration of these challenges. Children in the Immumax group also had fewer days absent from daycare, fewer unscheduled physician visits, and significant improvement in throat irritations and general immune response. Immumax is available as a 250 milliliter bottle in a great tasting berry flavor that kids are sure to love. Remember these criteria when choosing natural immune support products and consider Virusid and Immumax when addressing immune challenges.
Functional medicine is a science-based, whole systems approach looking at the fundamental underlying causes of clinical symptoms.
We're looking for not what is wrong with this person, but why this person has an issue.
It's not alternative medicine, it's not an either or. It's simply taking some of the new findings from systems biology and how all kinds of different influences can impact a person's health.
When you can understand the underlying causes of the disease versus just diagnosing the disease itself, you can have expanded options on how to treat that disease.
So many other practitioners are looking at what are the symptoms and what do I quickly do to treat those symptoms. I'm much more interested in what happened, what created that problem to begin with, and that's really what functional medicine is all about.
When it comes to the patient outcomes and what I've seen for them is that they can appreciate the idea that I'm looking at them as an individual.
Getting from the patient through their own words, their experience. We now know that genes plus experience creates the phenotype that we live in the world. So we have to understand where the person is coming from.
So we are looking at the way the body works in systems versus focusing on just the disease.
We're looking at genetics, toxicology, nutrition, psychospiritual issues, trauma, the whole big picture.
This gives us a set of tools that we can use to work with patients in a very systematic way when they've got a chronic problem to help unravel the cause of that problem and then address those underlying causes.
And you're giving them the roadmap, you're giving them the instructions, you're giving them the algorithm about how they can help themselves. You are engaging them as active participants in their care.
So the way that it's organized, the way that it's put together, would give everyone that ability to change that patient's life for good.
"75% of Americans are chronically dehydrated, and it has a bigger impact than you think. Fatigue, headaches, confusion, all symptoms of being dehydrated. Caffeinated and sugar-filled beverages like sports drinks, juices, coffee, soda, and alcohol actually dehydrate the body even more. The answer? Liquid IV, a healthy, all-natural rehydration beverage that promotes rapid recovery. Liquid IV utilizes oral rehydration therapy, a precise ratio of ingredients that enter the bloodstream more rapidly than plain water. The 100% all-natural formula contains 5 essential vitamins and more than 3 times the electrolytes of leading sports drinks. Liquid IV has more vitamin C than 3 oranges and more potassium than an entire banana. Liquid IV's proprietary blend is specially designed to aid in the body's natural process of eliminating toxins. Trusted by thousands, Liquid IV is the perfect choice for anyone with an active lifestyle. Used by professional athletes to recover from extreme physical exertion, traveling business executives for jet lag, and partygoers to remedy the dreaded hangover. Get Liquid IV. Put an end to your dehydration. What are you waiting for?